Today's session on Introduction to the Osteology of Skull. We are not going to discuss in detail about the skull, only what are the different bones and what are the different normas which are present in the skull. That only we are going to discuss in this session. Because each norma will take one class. So that's what we are not going in detail in this session. Just I will tell you what are the different bones which forms the different normas and what are the different sutures which are present and what are the different bony projections are present. Those are only we are going to discuss in this session. If you take any organ in the anatomy, we have to discuss that particular organ in anatomical position only. Because of that, we should know anatomical position of that particular organ. Here also, we are going to discuss the skull. So, we need to know how to keep the skull in anatomical position. If you keep the skull like this is not anatomical position. If you keep the skull like this is not anatomical position. If you keep straight also, we should know exactly whether it is anatomical position or not. For that, two planes are there. Those are Reed's plane and Frankfurt's plane. If you take the Reed's plane, see, last session we have discussed, this is superior orbital margin, this is inferior orbital margin. If you make the line from the inferior orbital margin to the external acoustic meatus, this line is Reed's plane. We have to make the line which is extending from the inferior orbital margin or infraorbital margin through the external acoustic meatus. This line what we are calling Reed's line or Reed's base plane. Reed's base plane or Reed's line. Then there will be one more line is there. Usually this line only most accepted line. What is that line? Frankfurt's plane. Frankfurt's plane means anterior point is same infraorbital margin, but that line should go above the external acoustic meatus. Instead of passing through the external acoustic meatus, this line has to go above the external acoustic meatus. That plane what we are calling Frankfurt's plane. Frankfurt's plane. So we are using either Frankfurt's plane or Reed's plane. Those planes should be horizontal to the ground. That is the anatomical position. Infraorbital margin to the suprameatal crest. Here this is suprameatal crest. Suprameatal crest means this one above it. So we have to make the line from the infraorbital margin to the suprameatal crest. Line has to pass through these 2 points. That is Frankfurt's plane. So that Frankfurt's plane should be horizontal to the ground. This Frankfurt's plane should be horizontal to the ground. That position what we are calling anatomical position of skull. Now we are keeping the skull in anatomical position because either Reed's plane or Frankfurt's plane. Now it is horizontal to the ground. This is anatomical position of skull. This skull will be divided into 2 parts mainly. This upper part of the skull what we are calling neurocranium. Why we are calling this neurocranium? Because it contains brain. So this is neurocranium. And this part below this region what we are calling viscerocranium. This is neurocranium and this is viscerocranium. When you are studying about skull, we should include the mandible also. If you include the mandible, then only it becomes the skull. Now we are keeping the skull in anatomical position. Then if you wanted to study the skull easily, you have to study under normas. What are normas? See here. Now I am keeping the skull in anatomical position and you are seeing from the front. This front part. This front part what you are calling norma frontalis. If you study the structures which are present in the front part of the skull, that is norma frontalis. Then I am turning towards the lateral side. This is the part which is present on the lateral aspect of the skull. If you study these structures, this is norma lateralis. So this is norma lateralis. Then I am turning behind. Now if you study the skull from behind, this region what we are calling norma occipitalis. Recollect once again. This is front part. So this is norma frontalis. This is lateral part. That's what this is norma lateralis. This is the posterior part. Mostly it is found with the occipital bone. That's what this is norma occipitalis. Is there any normas remaining? If you see from above, this region is there, no? This region is norma verticalis. You see from above, this region you can see, no? This region of skull, what we are calling norma verticalis. Then any other things are there? We have seen skull from above, we have seen skull from front, we have seen skull from lateral aspect, and we have also seen the skull from behind. What is remaining now? You have to see the skull from below this region. This is what we are calling norma basalis. So, when you are discussing about the skull, you have to discuss under these headings: norma frontalis, norma lateralis, norma occipitalis, norma verticalis, and norma basalis. Now we will try to discuss one by one. First we will discuss about the norma verticalis. If you see the skull from above, how it will be looking like. Actually, this skull is not normal. Some variation is there. That's what I am taking other skull. What is variation here? These are the two frontal bones. Usually, two frontal bones will be fused and will form a single frontal bone. See here. Here there is no suture. This suture. Here one bone is there. Here one bone is there in this skull. But here no two bones. These two has been united and forms a single bone. This is frontal bone. But why this suture is there? This suture what we are calling metopic suture. This metopic suture will be present only 3 to 8% of the individuals. Now we are seeing the norma verticalis. This is the norma verticalis. If you see from above, it is oval in shape. Anteriorly it is narrow and posteriorly it is broader. Why it is posteriorly broader? As we discussed little earlier, because of these parietal tubers, posteriorly it is wider, anteriorly it is narrower. Then what are the bones which forms the norma verticalis? You are seeing the frontal bone. You are seeing two parietal bones, and you are seeing small portion of occipital bone. And what are the sutures which are present here? Sutures means joint between these bones, what we are calling sutures, because these are the sutural joints. This is frontal bone, this is parietal bone, and this is one more parietal bone. This is occipital bone. Now we will see what are the different sutures which are present here. This is frontal bone, this is parietal bone, right? Frontal bone and two parietal bones are united by one suture here. This suture what we are calling coronal suture. Coronal suture. This coronal suture is example for the serrate type of sutures. Then here in between the two parietal bones, here one more suture is there. This suture what we are calling sagittal suture. This suture is sagittal suture. This sagittal suture is present in between the two parietal bones. This is also serrate type of suture. Then in between the parietal bone and the occipital bone, here one suture is there. This suture what we are calling lambdoid suture. This is lambdoid suture. The junction between the coronal suture and the sagittal suture, this point what we are calling bregma. This point what we are calling bregma. This is bregma. And the point between the lambdoid suture and the sagittal suture, this point what we are calling lambda. This is lambdoid suture, this is sagittal suture. This midpoint what we are calling lambda. So these are the different bones and different sutures which are present in the norma verticalis. Then few more points are there. We have already discussed two tubers are there. These two tubers are parietal tubers. Then here around 2.5 to 5 centimeters in front of the lambda, we can found two foramens here. Here one foramen, and of course here one more foramen will be there. That is not visible here. Okay. Here you can see. Here one foramen and here one more foramen. These foramens what we are calling parietal foramens. Parietal foramens. The midpoint between these 2 points are the midpoint between these two foramens. Here this point what we are calling oblivion. This is what we are calling oblivion. Why there will be foramens here? Because to maintain the intracranial pressure. Here some veins will be connecting the intracranial dural venous sinuses or intracranial veins with the extracranial veins. Those communications by the emissary veins. So whenever the increased intracranial pressure, blood will be escaped from the intracranial veins to the extracranial veins, so that intracranial pressure will be reduced. Because of that, emissary veins are present. That is advantage. If you take the disadvantage, if there is any infection in the extracranial part of, that means in the scalp, that infection can spread into the intracranium through the emissary veins only. So that's what it is having the one advantage and also disadvantage also. So these foramens what we are calling emissary foramens. Since they are present in the parietal bone, those foramens what we are calling parietal foramens. Then we will go for another one, that is norma occipitalis. This is the norma occipitalis. In the norma occipitalis, what bones are present and what sutures are present and what are the different bony projections which are present. Those are only we are going to discuss here. See, in the norma occipitalis, here one bone is there, here one bone is there. What are these bones? These are parietal bones. And what is this bone? occipital bone. What is the suture here? Lambdoid suture. This suture is lambdoid suture. And this junction between the lambdoid suture and the sagittal suture. This is sagittal suture, no? The junction between the sagittal suture and the lambdoid suture. This point what we are calling lambda. Then here there will be one more suture here. Suture is present in between the mastoid process of temporal bone and the occipital bone. This suture what we are calling mastoido-occipital suture. And here one more suture is there in between the parietal bone and the mastoid part of temporal bone. So this suture what we are calling mastoido-parietal suture. Then any other features are present here. Here you can see one bony projection. This bony projection what we are calling external occipital protuberance. This projection is there, no? This projection what we are calling external occipital protuberance. On either side of the external occipital protuberance, we can see two lines, one on either side. Here one line, here another line. This line what we are calling superior nuchal line. This line also superior nuchal line. Right? Then below that you can see one more line here, here and here. This line what we are calling inferior nuchal line. This is inferior nuchal line, this is superior nuchal line. Then if you observe carefully, from the external occipital protuberance, foramen magnum, there is one crest is formed. This crest what we are calling external occipital crest. This is what we are calling external occipital crest. These are the bony features which are present in the central part. Then if you observe on either side, here nipple-like projection is there. This is one nipple-like projection, this is another nipple-like projection. Here one nipple-like projection is there, and here one more nipple-like projection is there. These projections what we are calling mastoid process. This is the part of temporal bone. These projections what we are calling mastoid process. Then in front of mastoid process you can see one stylus-like projection here and here. These stylus-like projections what we are calling styloid process. These are the different structures or different bony prominences which are present in the norma occipitalis. Then we will discuss about the norma frontalis. For that another. Now we will discuss about the norma frontalis. This is the front part. That's what this norma what we are calling norma frontalis. See here, this is the frontal bone. This frontal bone having protuberance here, here and here. This protuberance what we are calling frontal protuberance. That frontal protuberance is more prominent in case of females. Below that frontal protuberance, we can see one bony elevation here. This bony elevation. This side also you can see bony elevations. This bony elevation what we are calling superciliary arch. This is superciliary arch. The point which is present in between the two superciliary arches. This point what we are calling glabella. Where females used to keep the sticker, no? That point what we are calling glabella. So this is glabella. Then if you coming little below, this is superior orbital margin. This is inferior orbital margin. This is lateral orbital margin. This is medial orbital margin. Just above the superior orbital margin, you can find one foramen here. This is supraorbital foramen. This foramen what we are calling supraorbital foramen. Through that supraorbital foramen, supraorbital vessels and nerves will be passing. Coming to the central part. This is the root of the nose. This root of the nose will be formed by nasal bone. See here. Here one nasal bone, here one nasal bone. These two nasal bones are united in the center and forms the internasal suture. Here is the internasal suture. These nasal bones are united with the frontal bone. These nasal bones are united with the frontal bone. So here frontonasal suture. This suture is frontonasal suture. Then if you turn little laterally, actually this is the maxilla. This maxilla is extending up to fuse with the frontal bone. Here one suture is there. This suture what we are calling frontomaxillary suture. Frontomaxillary suture. This is the maxilla. Maxilla having the frontal process. This frontal process will be united with the frontal bone. So forms the frontomaxillary suture. If you coming little below the nasal bone, here we can see pyriform shaped aperture. This pyriform shaped aperture what we are calling nasal aperture. So this nasal aperture leads to nasal cavity. This nasal cavity divided into two halves by nasal septum. At the lower part of nasal aperture, we can find one bony projection here. This bony projection, what we are calling anterior nasal spine. Margins of the nasal aperture. Superior margin will be formed by the nasal bone, and lateral margins and inferior margin will be formed by the maxillary bone. So that is about the nasal aperture. Then coming to the orbit. This is the orbit. This orbit having roof, floor, medial wall, lateral wall, base and apex. This is apex and this is base. Detailed description we will discuss little later. At this session, remember that this is the bony orbit. Bony orbit having roof, floor, medial wall, lateral wall, base, apex and the four margins: superior orbital margin, lateral orbital margin, inferior orbital margin and medial orbital margin. Then just below the orbit, here we can see one foramen. This foramen what we are calling infraorbital foramen. This foramen what we are calling infraorbital foramen. Here also, this is infraorbital foramen, this is also infraorbital foramen. Through that infraorbital foramen, infraorbital vessels and nerves will be passing. Then just lateral to that, here we can see one prominence. This prominence what we are calling malar prominence or zygomatic prominence. See here, this prominence is there, no? This prominence what we are calling malar prominence or zygomatic prominence. This prominence has been formed by the zygomatic bone only. That's what this prominence we can also call as zygomatic prominence. See here, this is zygomatic prominence. This is the maxilla. This is the zygomatic bone. Here one suture is there. This suture what we are calling maxillo-zygomatic suture. Over the zygomatic bone also we can found two foramens. These two foramens what we are calling zygomaticofacial and zygomaticotemporal. Zygomaticofacial foramen and zygomaticotemporal foramen. Through that corresponding vessels and nerves will be passing. And here one more suture is there. Actually this is a zygomatic bone. This is frontal bone. Here one suture is there. This junction or this suture what we are calling frontozygomatic suture. This suture what we are calling frontozygomatic suture. Then the lower part of the maxilla having the process. This process what we are calling alveolar process. This is the alveolar process. This alveolar process will give articulation to the teeth. So these are the teeth. They forms the gamphosis type of joints, right? So this is the alveolar process. Okay, if you wanted to say specifically, this is superior alveolar process. Superior alveolar process will be formed by the maxilla, and here this is inferior alveolar process. This inferior alveolar process will be formed by the mandible. This is the mandible. This mandible having body, ramus here. Here the fusion part of two bodies. This part what we are calling symphysis mentae, right? At the lower part we can see one protuberance here. This protuberance what we are calling mental protuberance. The highest point of the mental protuberance what we are calling gnathion. This is what we are calling gnathion. And here one more point is there. The junction between the internasal suture and the frontonasal suture. Here this junction what we are calling nasion. This junction is nasion, right? And one more thing is there, inion. Inion means what? This is external occipital protuberance. The summit or the highest point of the external occipital protuberance what we are calling inion. This is inion, this is nasion and this is gnathion. Then just lateral to that, here we can see one foramen. This foramen what we are calling mental foramen. Through this mental foramen, mental vessels and nerves will be passing. Then this process what we are calling inferior alveolar process. This process is inferior alveolar process. This inferior alveolar process will be giving articulation to the lower teeth. So this is the norma frontalis in brief. Then we will discuss about the norma lateralis. Okay. For that we will take other skull. Now you are seeing the skull from the lateral aspect. In the norma lateralis, what are the bones which are present here? See, this is the frontal bone, this is parietal bone, this is temporal bone, this is occipital bone, and this is zygomatic bone, and this is the mandible. These are the different bones which are present here. Of course, here sphenoid also present, right? Okay, recollect. Bones which forms the norma lateralis: frontal bone, parietal bone, occipital bone, temporal bone, zygomatic bone, sphenoid bone, mandible, maxilla. These are the bones which forms the norma lateralis. Then what are the sutures present here? See, small portion of coronal suture you can see, which is present in between the parietal bone and frontal bone, and you can see the Temporoparietal suture. See, this suture is temporoparietal suture. This is the example for the squamous type of sutures, right? Then here, this is the temporoparietal suture here, or mastoidoparietal suture. This is mastoidoparietal suture. Then here, mastoido-occipital suture. This is mastoido-occipital suture, and this is mastoidoparietal suture. Then any other sutures which are present here? What is this? Fronto-zygomatic suture or zygomatico-frontal suture. Zygomatico-frontal suture. Then what is this suture? We have discussed little earlier. Zygomatico-maxillary suture or maxillo-zygomatico suture. Here one more suture is there. This suture is temporo-zygomatic suture because this is a zygomatic arch. This zygomatic arch is formed not only by the zygomatic bone, it will be formed by temporal bone also. So, zygomatic process of temporal bone and the temporal process of zygomatic bone both are united here and forming this suture. This suture what we are calling temporo-zygomatic suture. So, these are the different sutures which are present in the norma lateralis. Then what are the bony prominences which are present in the norma lateralis? See here, this is the temporal line. Actually, this temporal line will be starting from the anterior part of the zygomatic arch. Then it goes upwards. Then it will be divided into two lines. See here, this is superior temporal line. This is the inferior temporal line. Right? So this superior temporal line will be ending at the posterior part of the parietal bone. But this inferior temporal line will be again, it will be entering into the zygomatic arch. So this is superior temporal line. This is inferior temporal line. Then below these temporal lines, this region is there, no? This region what we are calling temporal fossa. This region what we are calling temporal fossa. In the temporal fossa, one important point is there that is present at the antero-inferior angle of the parietal bone. That important point what we are calling pterion. See, this is the frontal bone. This is parietal bone. This is sphenoid bone. This is temporal bone. All these bones are united here and forms a H-shaped suture. This H-shaped suture, what we are calling pterion. This suture is pterion. Then any other features are present? Few we have already discussed. Nipple-like projection from the temporal bone, that is mastoid process, and the arch which is formed by the temporal bone and the zygomatic bone, zygomatic arch, right? And this is the ramus of the mandible. In the upper part, we can find the condyle. What is this? Condyle of the mandible, and this is the coronoid process of the mandible. Condyle of the mandible articulated with the condylar fossa of the temporal bone and forms the temporomandibular joint. This is the temporomandibular joint. And behind the temporomandibular joint, here external acoustic meatus. Behind the external acoustic meatus, nipple-like projection. What is that? Mastoid process. Then in front of nipple-like projection, this is styloid process. Then if you coming little front, this prominence what we are calling malar prominence, that is formed by the zygomatic bone. That's what we are calling as zygomatic prominence. Then ramus of the mandible. See, this is the ramus of the mandible. In between the condylar process and the coronoid process, here one notch is there. This notch what we are calling mandibular notch. At the junction of the body of the mandible and the ramus of the mandible, here angle is there. This angle what we are calling angle of the mandible. The highest point of the mandibular angle what we are calling gonion. This point what we are calling gonion. Here foramens are there. One is zygomatico-facial, another one is the zygomatico-temporal. Right? Here one more extra is there. Maybe one nerve or artery passing through the separate foramen. If you coming to the mandible, here one foramen is there that we have already discussed. That is mental foramen. So these are the different structures which are present in the norma lateralis. What is left with norma basalis? See, this is the norma basalis. The skull which you are seeing from the below. Yeah, this is good. We take this. This is the norma basalis. Norma basalis means we are seeing the skull from below. What structures will be present here? Before going to discuss about the norma basalis, if you divide the norma basalis into three parts, it is easy to discuss. See here, This part is anterior part. This part is middle part. That means anterior to the condylar process. This part is middle part. This part is posterior part. The anterior part will be formed by the hard palate and the alveolar process. See here, this is hard palate and this is the alveolar process. This hard palate has been formed by palatine process of maxilla. This is one palatine process of maxilla and this is another palatine process of maxilla. They have united and forms one suture here. This is intermaxillary suture. Then here, this is the palatine bone. This palatine bone also giving process that is coming medially. So that this is what we are calling transverse process of palatine bone. This is one transverse process, this is another transverse process. Both are united and forms the interpalatine suture. Right? So here interpalatine suture and this is intermaxillary suture. Then here one more suture is there in between the palatine bone and maxilla. So this is palatomaxillary suture. This suture what we are calling palatomaxillary suture. This is palatomaxillary suture and this is the intermaxillary suture and interpalatine suture. Totally it became cross-shaped suture. It became the cross-shaped suture. So that's what this suture totally what we are calling cruciate suture. Cruciate suture. Lateral to that, this is horseshoe-shaped alveolar process is there. That will give articulation to the teeth. Then at the posterior most part of the hard palate, here one bony projection is there. This bony projection what we are calling posterior nasal spine. Here we have seen the anterior nasal spine. This is the posterior nasal spine. If you observe here, at the posterior most part of the hard palate, here you can see one foramen, here one foramen, here one foramen. Behind that two more foramen, two small foramens. Right? So these foramens what we are calling greater palatine foramen. This is one greater palatine foramen and this is another greater palatine foramen. Then here one more small foramen is there. This foramen what we are calling lesser palatine foramen. This is greater palatine foramen and here is the lesser palatine foramen. And in the anterior most part you can see one more foramen here. This foramen what we are calling incisive foramen. This is incisive foramen. If you coming little behind, you can see two plates here. This is one plate, this is another plate. Right? You can see in this. Just behind the hard palate, here, this is one plate and this is another plate. This plate what we are calling medial pterygoid plate. This plate what we are calling lateral pterygoid plate. This is medial pterygoid plate and this is a lateral pterygoid plate. Right? Medial pterygoid plate shows one very sharp hook-like projection. This sharp hook-like projection what we are calling pterygoid hamulus. This sharp hook-like projection what we are calling pterygoid hamulus. In between the two pterygoid plates, here one fossa is there, no? This is fossa what we are calling pterygoid fossa. This fossa what we are calling pterygoid fossa. If you coming little behind, this is vomer. This vomer will form the nasal septum. Just above the vomer, this is the rostrum of sphenoid. This is rostrum of sphenoid and this is the vomer. Vomer in the upper part, it will be divided into two bony slips. These two bony slips will be articulated with the rostrum of sphenoid and forms the scindellysis type of joint. Scindellysis type of joint. If you coming little behind, this part, this total part will be formed by the greater wing of sphenoid. Actually this part of the base of the skull or the norma basalis has been formed by the greater wing of sphenoid. This greater wing of sphenoid contains some special features here. Here one foramen is there, here one foramen is there, here one foramen is there. Right? So what are those foramens? See, here oval shaped foramen is there. This foramen what we are calling foramen ovale. Right? Then behind the foramen ovale, here one more foramen is there. That foramen is present in the spine of the sphenoid. Spine of the sphenoid. So this foramen what we are calling foramen spinosum. This is foramen ovale, this is foramen spinosum. Right? Then here one more foramen is there, medial to that. This foramen what we are calling foramen lacerum. This is foramen lacerum. Structures passing through those foramens we will tell you in detail in the norma basalis proper. Then this bony projection what we are calling styloid process. Right? So this is styloid process, this is mastoid process. In between these two there is one foramen is there. That is stylomastoid foramen. Through that facial nerve will comes out. Then here one canal is there. Actually this canal has been broken. Usually we cannot see. this canal. Okay, the base has been broken. This canal, what we are calling carotid canal. This foramen which is present here is carotid foramen. This is the carotid foramen, right? Through this carotid foramen, internal carotid artery is entering and passing through the carotid canal. Then it passes through the posterior wall of the foramen lacerum. Then it appears in the cranial cavity. So this is carotid canal, right? Then in the lateral part, you can see one fossa here. This fossa, what we are calling mandibular fossa, for the articulation of condyle of the mandible, and it forms the temporomandibular joint. Then here these two are the condyles of occipital bone. These condyles of occipital bones will be articulated with the atlas, means first cervical vertebra. Anterior to this condyle, there is one foramen, anterior condylar foramen. Posterior to this condyle, posterior condylar foramen, right? Then in between and behind these condyles, here you can see big foramen. This big foramen, what we are calling foramen magnum. Through this foramen magnum, lower part of medulla oblongata, vertebral artery and meninges, spinal vessels, apical ligament of dens, membrana tectoria, and some other structures also will be passing through this foramen magnum, right? Then if you coming little behind, these structures we have already studied: external occipital protuberance, external occipital crest, superior nuchal line, inferior nuchal line. These structures we have studied in the norma occipitalis itself. So these are the different normas and their features in brief. In the further sessions we will discuss different normas in detail. That's it for this session.